Well, I don't have a story quite as touching as that, but the bravery in doing that and the hope that you give young women and any age women is wonderful. And I don't have the videos that Dr. Sechkin had, so I'm up for a lot of competition. So I'm here to talk to you about how physical therapists and other practitioners can help patients like Mackenzie and Padma if they have other underlying pain that can't be found and can't be diagnosed, and possibly they still have endometriosis or they don't have endometriosis anymore, but they still have this pain that no one is able to detect. This is a little bit about me. You can read it in the bios in the handbook. So the objectives for me today to educate everyone on is to be able to identify and assess abdominal and pelvic floor muscles and any trigger points, underlying trigger points or myofascial pain. Understand musculoskeletal causes of pelvic floor and abdominal dysfunction. Overview of physical therapy intervention of pelvic floor dysfunction and how other allied health and alternative practitioners can help. So the statistics show that 20%, up to 20% of women at some point between ages 18 and 50 suffer from chronic pelvic pain. In 2008, they showed that 1 out of every 4 women suffer from pelvic floor dysfunction at some point in their life. Up to 43% of all women suffer from dyspareunia or painful intercourse at some point in their life. And then physical therapy has shown to help 87% improvement in vulvar pain. There are multiple pain generators that can be identified. In a study by Chung et al., 178 patients with chronic pelvic pain, 75% of them had endometriosis, 89% of them had interstitial cystitis, and 65% of them had both. Baker said, musculoskeletal dysfunctions often contribute to the signs and symptoms of chronic pelvic pain and abdominal pain, and in many cases may be the primary factor. So I wanted to go through some anatomy education of the pelvic floor. The pelvic floor muscles connect from the pubic bone to the tailbone, and they help support the bladder, bowel, and sexual. They help contribute and support bladder, bowel, and sexual function. They surround these organs. Therefore, if there's a dysfunction in the muscles or some of the abdominal muscles, it can refer pain to the pelvic floor and pelvic and abdominal region, as well as the back. This is a side view of the muscles. The muscles make up the levator ani, the obturator internus, the coccygeus, and the piriformis muscle. As well, there are a lot of nerves that come out of this region, the sacral and lumbar regions, so any type of pain can irritate nerves, as well as it could go back and forth. The pain can irritate the nerves and the tissues, and it can become a vicious cycle. This is an example of the pudendal nerve and other nerves in the pelvic floor region. And you could see how many nerves there are and how it's so susceptible to nerve irritation as well as any muscular irritation and pain. The function of the pelvic floor and the abdominal muscles is they are supportive. They allow for stabilization of the trunk. The pelvic floor as well has a sphincteric function as well as sexual function. The role of the pelvic floor and abdominal musculature, more specifically, it assists in unloading the spine, it assists in pelvic spinal stability, and the pelvic floor alone reinforces urethral closure during increases of intra-abdominal pressure, has an inhibitory effect on the bladder and bowel activity, and contributes to sexual arousal and performance. Therefore, pelvic floor dysfunction can result in disorders of the bladder, bowel, sexual function, and pelvic pain. I'm just going to go over briefly signs and symptoms that you may hear or see from patients, and it's important to realize and to really recognize that these signs and symptoms can be contributed from musculoskeletal causes or from endometriosis. So disorders of the bladder that they may describe: urinary frequency, urgency, retention, and or burning, pain, pressure, difficulty with initiation and or weak stream, incontinence, stress, urge, or mixed, as well as pelvic organ prolapse. And examples of diseases or disorders that can cause this, again, endometriosis and painful bladder syndrome. So you can see the bowel symptoms and signs are similar because of where the muscles are located. If there's tightness or hypertonicity or spasm in the muscle, it can cause similar symptoms: bowel frequency, urgency, retention, and or rectal burning, pain, pressure, difficulty with initiation, incomplete emptying of the bowel or bladder, incontinence, pelvic organ prolapse. As well, the patient may describe gas, diarrhea, constipation, bloating, abdominal pain. Sexual dysfunction can be, and obviously this is for the older women, not older women, but not the young women. The pain can be described at the introitus or deep vaginal pain. It can be described as burning, sharp, shooting, stabbing, knife-like pain, tearing, aching, dull, nails. They may describe it as nail-type pain. As well, they could experience decreased libido and difficulty with orgasm. So common conditions that as physical therapists we see and can treat, as well as the other disciplines which I'll go into later: vulvodynia, vestibulitis, vaginismus, dyspareunia, endometriosis, or pain from endometriosis affecting the musculoskeletal system, pelvic floor tension myalgia, pudendal neuralgia, levator ani syndrome, painful bladder syndrome or interstitial cystitis, IBS, and bowel disorders. So the causes from a musculoskeletal point of view can be from skin pain or irritation or myofascial pain, connective tissue tightness or scarring in that region. Muscles can develop trigger points and tightness. Nerves can get irritated. The skeletal malalignment can occur. If any surgery results in having to cut a ligament, that could contribute to skeletal malalignment of the sacroiliac joint or the lumbar region, as well as pelvic congestion, and as well the psychosocial and hormonal issues that contribute to all of these dysfunctions. So common referrals that we see for physical therapy: orthopedic from the orthopedist, the urologist, the GI, colorectal, the GYNs, mental health, nurse practitioners, pain management, and pelvic floor dysfunction can and may affect men, women, and children. The onset typically is multifactorial. It's not just one cause that causes their pain and their discomfort. It could be from trauma, a bike accident, a fall, childbirth, physical or emotional trauma. It could be from a previous condition, whether it's surgery, hysterectomy, laparoscopy, episiotomy, urinary tract infection, or yeast infection, as well as from endometriosis, or cancer, poor posture, or repetitive motion. So this can cause a vicious cycle. The trauma, the postural, poor postural positions, and or surgery can cause inflammation and weakness, scar tissue, decreased mobility of surrounding tissues, muscles, nerves, and organs, and more weakness and more pain, and the cycle continues. So it is so important to address the person and the body as a whole. You need a proper diagnosis from practitioners that are well educated on these topics, as well a proper musculoskeletal diagnosis. Mental health issues should be addressed, behavioral modifications, diet, exercise, and postural exercises. Again, it is essential to find a healthcare professional trained in pelvic floor dysfunction. As everyone was mentioning, endometriosis is a fairly new diagnosis and disease that people are discovering can be a huge problem. And physical therapists or healthcare providers are realizing that pelvic floor dysfunction can also be a contributor to some of this chronic pelvic pain. So it's essential to find the appropriate practitioner. Physical therapists are experts in the musculoskeletal system, and they are allowed to assess and treat the internal as well as external muscles. So that's important to know. As physical therapists and other allied health providers, we take a detailed history. We want to know when the pain started. Questions like, does the period make your symptoms worse? Does ovulation make your symptoms worse? Where is the pain? What makes it worse? What makes it better? Have you had any previous surgeries? Have you been diagnosed with endometriosis? A history of bladder, bowel, sexual dysfunction, as well as if they know anything that caused the onset of their symptoms. For the objective part, we would go through a postural and structural alignment assessment. Is there any scar tissue that's causing the pain? Is it surrounding a nerve that's causing pain in the back or abdominal region? We'll look at visceral mobility. Is there scarring all around any of the organs that's causing pain and a problem? Trunk, hip, lower extremity palpation is important, range of motion, and strength testing. Neural tension, are there issues with any nerves in the abdominal or pelvic region? Movement patterns, motor control, pelvic floor, abdominal muscle exam, including the perineal and the internal muscles if necessary, as well as breath control. Is the patient contributing all their symptoms by having hyperventilating type or shortness of breath that's contributing to their discomfort? So as you could see, there is a lot going, as you saw before from the videos, there's a lot going on in the abdominal region, and it's so important to assess what is the contributing factor to their pain. So as physical therapists and as nurse practitioners, you can assess, is the pain also musculoskeletal in nature? Is the psoas muscle, the rectus abdominis, the obliques, are there trigger points in that muscles that aren't going away that are contributing to more pelvic and abdominal pain? How are they using the muscles? Are there restrictions and tenderness in that area? The pelvic floor muscles are also important to look at. The urogenital triangle can have trigger points in pain contributing to pain in that region, as well as the deep muscles surrounding the rectal area and vaginal area. Are there trigger points and restrictions and decreased motion in that area? So a pelvic floor muscle exam can be, you would basically just insert your finger and you would palpate the lateral muscles, sidewalls, as well as straight down towards the rectal region, or at 6 o'clock. You would also look for, are there any skin issues, fissures? You can do a neurological exam. Is there decreased sensation? Is there increased sensation? You can do a Q-tip test to see if there's tenderness around the vestibule. The urogenital triangle, as I mentioned before, the external areas, are there trigger points in those areas, as well as the internal muscles. So why is this happening? Weakness or disuse, trigger points, connective tissue restrictions, visceral restrictions, and just back, hip, SI joint dysfunction can cause pain in the pelvic and abdominal region. Are there scar adhesions that are contributing to the pain? And how and where, how it feels. The patient may describe it as a weak feeling, a falling out. Muscle pain is described as ache, dull, pressure, tightness, pulling, spasming. Nerve pain is described as stabbing, burning, itching, shooting, sharp. The patient may say when they go to the bathroom, it feels like there's nails, that they feel nails, or when they're engaging in sexual activity, it feels like nails. This could be, an underlying cause of it could be musculoskeletal dysfunction. As well, what I mentioned before, it could be in the back, tailbone, abdominal, genital, pelvic, groin, leg, hip pain. What I was mentioning before, that nerve pain can be mistaken for other diagnosis and symptoms. I've had many patients say it feels like a yeast infection or urinary tract infection, but there's no diagnosis of yeast or a urinary tract infection. But it's actually nerve irritation and nerve pain that's causing vulvar pain, burning, itching, bladder, urethral pain and burning, abdominal referring pain, genital and rectal pain. So how it affects their function. Functional limitations for children as well as adults, it could affect their play. You already heard from Mackenzie how it affected her for 3 years. So it's so important to get the whole to look at the whole picture and get the whole diagnosis from your patient. It could affect school, work, socializing, family, activities of daily living, exercise, and or all activities. So the treatment for physical therapy and acupuncture can be fairly similar because acupuncturists can work with trigger points as well as meridians, Eastern and Western acupuncture. Pelvic and abdominal pain, there could be muscle incoordination. They've had pain for so long that they're gripping the pelvic floor muscles. They're not allowing the proper evacuation of the bladder and bowel. Therefore, they're getting retention. So teaching relaxation techniques, learning how not to tense the muscles, including the abdominal muscles. The body, when it's in pain, the reaction is to curl up into a ball. That alone can contribute to trigger points and restrictions. It can stretch out muscles that shouldn't have been stretched, like your back, and the abdominal muscles can tighten and shorten. So I thought this was very appropriate. Mommy, can you help my fingers remember how to snap? These women, they are in so much pain and discomfort that they may forget how to use their abdominal muscles and their pelvic floor muscles properly. But physical therapy is more than just biofeedback. A lot of people associate biofeedback with physical therapy for pelvic floor dysfunction. There's a lot more that physical therapists and the acupuncturists, if they're trained, can do to help pelvic and abdominal pain. Manual therapy to the muscles has proven to help with any trigger points, scar tissue release, as well as connective tissue mobilization. And it can be internal or external. For our younger population, we obviously try to do all external treatment as well as other treatments that I'll go over. For those that are sexually active, dilators could be a possibility as well as manual therapy. Travell and Simons has a great book on trigger points and how they can refer to other areas of the body. Pelvic pain can be caused by any of the muscles mentioned here, the coccygeus, the levator ani, the obturator, adductors in the inner thigh, the piriformis, and the obliques, and the abdominal muscles can refer to the pelvic region. Iliosacral pain, levator ani, coccygeus, gluteus muscles, quadratus, as well as rectus abdominis, those can also refer to the abdominal pelvic region. The iliopsoas muscle, which is your hip muscle, it goes right through the abdominal wall, and that can cause trigger points and referred pain into the abdominal area and into the pelvic floor. It can refer into the rib cage and the back, into the groin and the thigh. So the treatment, in addition to the manual therapy, can be stretches, strengthening exercises, core mobility and stability is very important. HEP is home exercise program, massage therapies to do at home, self-care techniques, stretches, relaxation techniques, even just techniques of using a hot pack can help some women. Behavioral modifications is very important as well. Posture, positioning, breathing patterns, relaxation, toileting techniques. If they're straining, that doesn't help the pelvic muscles at all, or the abdominal muscles. It can cause more irritation and pain. So adequate water and fiber intake is very important, eliminating any dietary irritants, and education that sex should not be painful. Physical therapy has been researched to be effective for pelvic and abdominal pain with manual therapy and with or without biofeedback, as well as pelvic floor and abdominal muscle re-education. The symptoms of pelvic abdominal pain often do not appear to be of such a nature that the patient seeks out a physical therapist to help. The first step in the process, therefore, can lie with the physician or with all of you, the nurses, who are able to identify signs and symptoms of musculoskeletal disorders. Again, the vicious cycle, it is so important to address all the aspects that the patient needs and to really listen to hear what is causing and contributing to their pain, their anxiety, and their tension. The multidisciplinary approach is key for physical therapists. They can at least assess to see if there are any musculoskeletal disorders involving their pelvic and abdominal pain. The physician, nurse practitioner, psychological services, stress management is also key. I recommend all my patients, even if they're seeing a psychologist, they may need to see someone in addition or who has different training. For instance, the cognitive behavioral therapy that was mentioned before, it is so essential to address all components. Acupuncture can be helpful, yoga, nutrition. So acupuncture, I basically interviewed a couple people for this because this is not my area expertise. Acupuncture is used to calm an upregulated nervous system, alleviate symptoms of depression, anxiety, and stress, promote better sleep, which was very important to allow your body to heal. Relaxation makes it easier to deal with any pain and discomfort. It helps to relieve pain by releasing endorphins into the system, increases blood flow to the pelvic and abdomen, promoting healing. It can break up scar tissue, balance and regulate the hormones, thus promoting normal menstrual cycles, relieve the resulting musculoskeletal pain over problematic visceral areas. Mental health support. Dr. Wilson already went into this, so I can't do the same justice as he did, but I did interview a psychologist, and she mentioned that mental health support can increase knowledge to enhance understanding of symptoms as well as everyday functioning and activities, normalizing and validating their feelings, experiences, and reactions, restoring a sense of control, addressing how to educate family and friends, decreasing psychological symptoms, learning cognitive behavioral strategies to manage stress and anxiety, and promote awareness. So the goals of a mental health care provider would be symptom reduction, improved understanding of relationships between psychological factors and physical health, improved interpersonal and social functioning, improved health maintenance behaviors, and quality of life. Yoga, I'm a huge advocate of yoga to help with relaxation. If that's right for you, yoga may not be the answer for everyone. Sometimes like Tai Chi is more helpful because it involves more flowing motions. Every person is different, so it's really individualized what helps each patient. Yoga is the union of body, mind, and spirit, eliminates fear of movement that is due to pain. Symptom reduction, it helps to activate the PNS, the parasympathetic nervous system, and calm the sympathetic nervous system. When you're in pain, you experience the flight and fight reaction. That activates the whole sympathetic nervous system. It contributes in central sensitization, and then their whole body's hurting. Yoga and other relaxation techniques and exercises can help calm the central nervous system down. Reconnect and reprogram to equal pleasure and joy with movement, promote awareness and importance of breath and posture. Nutrition, as a physical therapist, we do go over the very basics of nutrition. But if it's something very detailed, we may refer out for nutrition. So we'll go over food basics, the importance, as you know, of the pyramid. Fluid, fiber intake is very important, not getting constipated and aggravating the abdominal muscles and the pelvic floor region. Straining aggravates the pelvic floor muscles and any nerves that are irritated. Straining is not helpful in this situation. Increasing anti-inflammatory foods, decreasing inflammatory foods, lactose-free diet, gluten-free diet. Some people respond well to this, some people don't. So again, really figuring out what works for the patient is important. So the goals of nutrition would be to review and analyze current diet and food intake, food recommendations to alleviate symptoms, easy recipes, meal plans to reduce inflammation, pain, constipation, and to eliminate symptoms in the future, education on how to maintain results after returning home, menu reviews to ensure healthy eating even when ordering in or dining out, and recommendations tailored to your personal food preferences and lifestyles. So thank you very much. I wanted to thank Dr. Sedgkin and everyone in the Endometriosis Foundation and Padma. I'm very glad to be here and to be able to speak on this topic. Thank you.